Hello, I'm Steve Newton, President of Baylor University Medical Center here in Dallas. We'd like to provide you with a glimpse of the Baylor Charles A. Sammons Cancer Center, one of the nation's leading cancer treatment and research facilities. We have gold level accreditation with outstanding achievement from the Commission on Cancer, meaning that we put quality, safety, and patient experience as a top priority. And we're continually finding new ways to improve and enhance our care. Across Baylor Scott & White Health, our physicians and clinicians care for more than 150,000 cancer patients a year. Here in Dallas, we're not only a resource for our community, but a destination for patients seeking specialized care that's uniquely tailored to their individual cancer journey. We're so thankful for this unique and beautiful facility, but it's truly the expertise of our teams, the patient-centered programs, and innovative research that sets us apart. So come, let's take a look. Let us share with you more about how we are so committed to making a difference for cancer patients every single day.
Hi, I'm Gerard Zarowski. I'm the Director of the Biotechnology Center here at the Baylor Research Institute. We're dedicated to finding new treatments for diseases and illnesses. Clinical and translational research are key components of the quality care being practiced here. Our Institute for Immunology Research is a world-recognized leader in human immunology research. Scientists at the Institute work to understand the healthy immune system and how it's impacted by infectious diseases, cancer, and organ transplantation. The Institute has conducted a series of therapeutic cancer vaccine trials in which a patient's own immune system is used to fight their cancer, and we're working on new technologies for cancer vaccines. We are a leading clinical research institution that is continuing its scientific and clinical advances towards better patient care.
Our tumor conferences are an important academic event. I'm Dr. John Prescott, and I have the pleasure of overseeing our tumor conferences as we challenge each other to think, to adapt, and to be innovative. Nearly 250 of these site tumor conferences are held annually with more than 6,700 participants. Residents and fellows are part of this high-level classroom, presenting not only before their own peers, but before medical experts with various specialties. I know of no other institution that conducts a similar scope of regular, multidisciplinary oncology conferences like this. The finest physicians understand that diagnosis and treatment options are always changing. We're not second-guessing each other, but we're seeking knowledge when a patient case study is brought before this esteemed panel.
I am Dr. Carlos Becerra. I am the Director of the Innovative Clinical Trial Center. This is the centerpiece of cancer research at Baylor, offering access to some of the most promising national clinical trials for a broad range of cancers. The Sammons Cancer Center is home to 150 clinical trials, and more than 800 patients take part in this research, including many whose cancers have resisted standard treatments. These trials are being managed by some of the leading oncologists and scientists from across the country. Here in the Innovative Clinical Trial Center, vaccines are being developed against melanoma, pancreatic cancer, and we're working to make it easier for chemotherapy to reach cancer cells. I'm excited about the possibility of harnessing the immune system to control or at least suppress these type of tumors. The Innovative Clinical Trial Center, where innovation leads to discovery, with the hope that the progress seen here will lead to treatments that become available to all patients in the future.
Caring for cancer patients can be a very complicated task. Here at Baylor, our team-focused care sets us apart. Our multidisciplinary teams are made up of physicians, nurses, dietitians, social workers, and pharmacists who use their specialized skills and expertise to make the best decisions.
Good morning. Good morning. How are you? Good.
Every day, our teams go room to room, meeting the patients one-on-one. We understand a cancer diagnosis can be very stressful. but our medical experts are dedicated to answering any questions or concerns that you may have. This team approach allows us to better review cases, reevaluate reports, and discuss the best treatment options. Patients should feel reassured that our specialists are working together and considering different perspectives. Personalized attention, coordinated care, the kind of team you want on your side.
I'm Stacy Webb, and I'd like to share our patient navigation program with you. Nurse navigators are the champions of patient care. Every family who walks through our doors will have an advocate to guide them through their cancer journey. Our nurses create a support structure that allows patients to streamline the process. Nurse navigators are there every step along the way, working with a team of doctors and nurses to provide efficient, timely, and quality care. We help patients obtain medical records, assist with lodging and resources, and provide education about their treatment process.
During the week, I live in denial, but then when people talk about it, it just brings up memories.
A nurse navigator is the hand to guide you, the shoulder to comfort you, and the one who will be with the patient during treatments, appointments, and into survivorship. As part of the care team at the Baylor Sammons Cancer Center, you will come to understand what it means when I tell a cancer patient two simple words: we care.
I'm Dr. Michelle Schiller, pathologist and co-medical director of cancer genetics at Baylor University Medical Center. Knowing that you have an inherited gene mutation can help you and your family detect or even prevent cancer at an early stage. Do you know that we all hold information inside of us that could potentially save someone's life? In each of us, we have genes. Think of them as little packets of information, a code that the body uses to make proteins and also regulate the balance of your body. But if there is a mutation in a gene, it can no longer do the job and stop cells from growing out of control, which can lead to cancer. Our genetic counselors at Baylor are specially trained and board certified to support our patients through this journey. We help identify patients at risk for hereditary cancer syndromes, something that impacts 1 out of every 10 cancer patients. Most of the genetic testing we do involves a regular blood test. We work closely with each patient, learning more about your family history and helping you understand what the results mean, not only for you, but your family and children. Our team also offers you access to support groups and other resources to help maintain control over your life. The decision to have genetic testing is not an easy one. Results can affect many aspects of a person's life. But our goal is to empower you, help you gain the information you need to make the best decisions about your health.
My name is Susan Sales. I'm the manager of the Virginia R. Savetco Education and Support Center, and I'm a cancer survivor too. Today, there are over 15 million cancer survivors in the United States. Through compassion, science, and technology, that number is growing.
It was a little bit more of an aggressive tumor, and because of that...
While dealing with a cancer diagnosis is hard, adjusting to the physical and emotional changes after treatment can be just as tough. We're here to provide you and your loved ones with the tools, support services, and educational opportunities that you can use as a survivor. Once treatment ends, we understand the cancer experience continues. Our survivorship program begins with an individualized treatment plan agreed upon between you and your physician. Then we add methods to maintain and promote your health during this transition. We are continually defining and refining how our survivorship program will meet patients' needs once they resume their lives as cancer survivors. As a cancer survivor, I'd like to address cancer patients directly. Our goal is to make a life saved, a life worth living to its fullest. As you walk through the cancer journey, you'll be showing everyone what courage looks like. It may be a new normal, but you're not alone in this journey back to health. We will help you build a community of support, one relationship at a time.
As you can see, patients at our cancer facilities receive total wellness and advanced therapy options from some of the very best in the field. And our comprehensive cancer center continues to expand. Our campus will soon be home to the American Cancer Society's Hope Lodge, a convenient and comfortable place for cancer patients and their families to stay while receiving extended treatments. Advancements funded through our innovative Cancer Clinical Trials Center will also help us continue to bring new treatment options to more patients. Now that you've had a look at the Baylor Charles A. Sammons Cancer Center at Dallas, I hope that you agree that this is the place for cancer care, research, and education.